I've seen children that have been affected by it. I mean, majorly affected, where their mental stability has been affected to where just due to carelessness in the home. So it's something that needs to be worked on diligently.
Lead poisoning is a problem for children everywhere, really. It's a syndrome that is totally preventable and essentially robs children of their future.
When the children are young, under 6, that's when their brains are developing so quickly. So even a very tiny amount of lead can cause permanent brain damage.
The end result is decrements in IQ, so a children literally is less intelligent than they could have been, so they lose that potential.
Working to reduce the risk of lead exposure really ties into environmental justice, because the populations at the greatest risk of lead poisoning are disadvantaged in minority communities.
So the mission of the Children's Environmental Health Initiative, or CEHI as we call it, is to foster environments where all children can prosper. And we focused on intervention strategies, issues of environmental justice, and behind all this, our technical strength is in geospatial analysis.
We use software that enables us to take information on health statistics, environmental variables, and map that geospatially. The most important variable in our model is the age of housing in a particular household. However, we have a variety of other variables that can impact the risk of lead poisoning, including the household median income, the percent of people living in poverty in the nearby area, and demographic variables such as percent Black, percent Hispanic, percent white.
The Durham Affordable Housing Coalition has been here for 20 years doing advocacy around affordable housing, and then we started a campaign for decent housing to help people make their homes safe from lead and other hazards. We use the maps from CEHI to determine which houses are possibly have lead hazards. Houses that are older have lead, and then if people don't have the money to repair them, then they're more likely to have lead hazards. And we've found that they're pretty accurate, especially in East Durham. We find in all the neighborhoods that we visited, we actually literally will run into people who've had children who are lead poisoned. We have people that we hire from the community, and if we can, we hire people actually from the neighborhood. And we go door to door and we talk to people about lead poisoning and ask them if they would like help testing their house for lead. And it's a totally free service. And it's amazing how many people say, yes, you know, you can come in and test my house.
We're here at the home of Javon Thomas, and we are about to explain to him how to test his home for lead dust from lead paint. And I've explained to Javon that he would put his gloves on, he would open the lead wipe, which he has in his hand, and he would move the lead wipe inside of the template in an S pattern, one way, then go the opposite way. You would take the wipe and fold it over again so you're wiping with the other side of the wipe, and do the same movement, making sure that you don't go underneath the template, that you just stay inside of the area.
Well, the city has had lead grants. Right now they don't have a lead grant, and we've worked with the state to get some money into Durham for lead poisoning prevention and lead abatement.
A typical house like this would be, the biggest concern is windows. Dust is generated with the window going up and down. So we remove the old windows and put in new vinyl windows. If we're dealing with a historical property, we have to come back and put in wood sash windows to match everything for historical. We could remove baseboard, door casings, door jambs, doors. A piece of lead the size of a pinhead on a wipe will fail my job.
And unfortunately, because Durham has a lot of older homes, some years we still have the highest number of kids who are lead poisoned, but now the numbers are very low. Instead of dozens of kids, it's, you know, maybe a handful.
We're not there yet. We have a goal, a Healthy People goal for 2010 to eliminate lead poisoning in children. Nationally, we still have 250,000 children a year with lead poisoning.
And what we really need to pay attention to is future generations of kids.
Anyone that sees this, if they have questions, they need to contact their local government and see what kind of programs they have that they can get involved in, especially if there's children in the house. It's a major problem, you know, not just in Durham, but all over the United States.